Hello, this is Dr. Ford Brewer with state-of-the-art heart attack and stroke prevention. This is part 3 in a series on what the practice is like in terms of heart attack and stroke prevention. As I've mentioned a couple of times before, we use the Bale-Duneen method, which is delineated in this book. First thing we do is look for plaque. We use the CIMT, or carotid intima media test, which is a carotid ultrasound. If you have plaque, we need to know if there's inflammation. If there's inflammation, then we need to cool that down. There are a couple of drug classes. The statins, the ACE inhibitors, those tend to freeze that inflammation while we're looking for and helping you work with root cause issues like insulin resistance. So this part of the series, again, is questions about the practice. One of the first questions was, do you prescribe? And the answer is, of course. There are a couple of ways that we can do that. We can do telemedicine for over 30 states in the country. Most of our patients still come into Nashville to see us because this is a significant workup. There are decades of your life that weigh in the balance here, so I would ask you to take it seriously. There are a lot of people that just can't, and they need to do it in the privacy of their home and comfort of their home and can't travel. And again, we've made telemedicine available to quite a few people. For how telemedicine works, I've done a complete video on that. Please see that video. The second question is, what are the most common prescriptions you use? Well, again, since we're firemen, we're looking for fire or plaque in the arteries. We use the anti-inflammatories. In this case, for cardiovascular inflammation, it's not steroids or non-steroidal anti-inflammatories. It's a couple of other drug classes, statins and ACE inhibitors. Those are commonly used. By far the most common medication treatable root cause is insulin resistance, so we use a lot of metformin. There's another commonly used medication for insulin resistance. It's called pioglitazone. So we use a good bit of each of those. We recommend a lot of supplements, not nearly as many as you might think. We're not like an alternative medicine type of shop. We're, for the most part, standard medicine. We just approach it more from an inflammation perspective as opposed to just worrying about LDL. In fact, when we give statins, we're more concerned about inflammation than we are about the cholesterol value, because inflammation is a much more imminent risk for heart attack and stroke. So the next question, what are the most common problems that we see? Well, plaque and inflammation. Again, we see a lot of baby boomers. And there's a process, a natural process of laying down some plaque or soft cholesterol between your intima and media layers of your arteries. They've even shown that from birth. What they've also done is done population parameters by age, and you can actually even provide the patient an age estimate of their arteries. Another common problem is inflammation. So when you do find plaque in artery walls, you want to look to see if there's inflammation. You want to look to see if there's damage to the intima. It's called in Brad and Amy's book the tennis court, because there's a lot of space there, enough to cover 5 or 6 tennis courts. That's the intima, the lining of the arteries. What are some common root causes? Well, one of the most common that we see is insulin resistance, prediabetes, metabolic syndrome. Those are all the same thing, just different terms for that. Overweight, obesity is a driver for it. Sleep dysfunction, high blood pressure, all of those tend to be associated in terms of causes, related causes of heart attack and stroke risk. There's another one that we see quite a bit, Lp(a). Again, I've got a couple of videos on that. Atrial fib is a common problem once you get into middle age. We see a lot of atrial fib. What are some other problems that we see? Tooth infections. There's been a debate about dental infections for 3 or 4 decades based on some research that Brad Bale and Amy Donine and a friend of mine, David Vigorous, have been doing. It looks pretty clear that dental infections are causative of heart attack and stroke risk through inflammation. Another question, what are the most common interventions? By far the biggest intervention is lifestyle. And a lot of our patients don't want to take any kind of medication. So again, by far, most of them come out of that first visit saying, let me just try to tune up my exercise, improve my diet just a little bit, do a couple of other things. Even if I've got some inflammation, I want to work on that a little bit more before I bite the bullet and start taking statins or something like that, or metformin, or again, whenever medications are indicated. Okay, another question about medications. Which specific medications do you use? Most often, in terms of the statins, very low dose Crestor. Crestor is one of those statins that can cause risk for diabetes in the higher dosages, but you don't need higher dosages. You need very small dosages, and even 3 times a week kind of dose. So it doesn't cause increased risk for diabetes at that level. But it does have a huge positive impact on inflammation. Ramipril, one of the ACE inhibitors, we often use that. For insulin resistance, again, very common, we use metformin and pioglitazone. For obesity, we have used Contrave. Next question, do you do telemedicine? Well, that's sort of a layup question. We've talked about that a few times, and I've got a couple of videos on the telemedicine process. A lot of people have questions about that. Thank you again. Ford Brewer with Heart Attack and Stroke Prevention.